Hi, I'm Alistair Ross, Chief Executive of Wedo Health and Safety Limited. In these times of coronavirus and COVID-19 and all the fears that are being stirred up by the press about getting everybody back to work and people saying that they're frightened of coming back to work, one of the things we need to do is to make sure that we have safe workplaces for people to come back so that they don't fear that and that they feel confident that the employer, as in you, have turned around and decided that it needs to be a safe place for them to come back. Now, there's certain things that we need to think about. Well, first of all, the very clear basics are very simple. You have a duty to reduce the risks to the lowest possible practical level by preventative measures. So that's the top line of that. The stay alert, control the virus, save lives is about minimizing the risk of this happening and spreading. So what we need to do is we need to really think about that. But more importantly, we need to make sure that our employees totally understand what their responsibilities are. Because if they don't understand that, then they won't apply it. They need to almost buy into it. And if they do that, then we stand a chance of getting them to do what they need to do so that they're safe and you're safe. And all the other people that they work with are also safe. And it's about protecting the business as well, making sure that you're not at risk of getting into trouble. So let's have a look at some of the obligations that you have as an employer. Well, first of all, you need to understand that the Health and Safety Executive has designated that coronavirus and COVID-19 is an occupational reportable disease. So what that means is that if somebody catches it, technically speaking, you need to carry out an investigation, report it to the Health and Safety Executive and all the paperwork and stuff that comes with it. But if you just have one person who's come to the workplace and they've got symptoms, then actually self-isolating is possibly sufficient. For it to go to COVID-19, that means they're actually in hospital, probably more than 7 days, and it's a severe risk. So the questions all come down to whether or not you have put in place all the necessary steps you need to do to make sure that it hasn't occurred from your workplace. So what sort of things do you need to do? Well, just in its simplest form, you need to first of all carry out a COVID-19 specific risk assessment. So that's something that's going to take a hard microscopic look at what it is that you're doing. What procedures, processes, systems have you put in place that are going to minimize the transmission of risk? It doesn't mean taking your whole health and safety management system and changing every single document in it to refer to COVID-19. At some stage, it's hoped that we'll be out of the worst of this and in fact back to a more normal than we're likely to see in the future. So what we need to think about then is just doing something that gives us an overriding specifics and points to the other method statement and risk assessments that you may have in place. But whatever you do, you need to be communicating and sharing this with your workforce. It's quite simple. If they don't understand their responsibilities, as I said before, then they won't put it in place. And unfortunately, ignorance is not a defense. If you've got more than 50 employees, you're required in law to publish this on your website. My strongest recommendation is that you do it anyway. And the reason for that is that if you're a small business, but you want to give your customers confidence that you're taking this issue seriously and you've put every necessary step in place, then publish it on your website if at all possible. It means that people can go to it, they can read it, and they can be confident that when they come and they shop or they come to your office or they purchase product from you, that you've taken every reasonable step to make sure that's okay. And whatever you do, make sure you publish a poster around the place. This is the one that the government have suggested you do, but it absolutely needs to clarify that you're taking all of the steps that you need to comply with the COVID-19 risk management process. So what sort of other documents might you need? This is one of the problems with health and safety. It always gets a reputation for lots and lots of bits of paper and nobody actually applies anything practically. Well, we try to make sure that that's done a little bit differently and look at ways in which you can do things. But let's just deal with the documentation first. So you need your COVID-19 risk assessment, which is what I've just referred to, but you also need a COVID-19 specific policy. So that policy is something that would go into your human resource manual, your HR manual, your company manual, operations procedure, whatever it is that you operate to. But you need to have something that's a policy that then points to the fact you've conducted a risk assessment. And it may have things like the change in shift pattern that you've got, the steps that you're going to do, but maybe not in quite so much detail as your safe working arrangements would have, because you need to put that in place. But you also need to get some documents signed by your employees if you want to cover yourself. So things like making sure you've done a toolbox talk with all employees when they come back to work, explaining what the parameters are, what their responsibilities are, what they can and cannot do. You need to think about getting that signed off along with a PPE document. So if you've issued personal protective equipment, then make sure you've got something signed off and written. And finally, I would make sure that you have training records put in place, that if you've trained people in any of your process, that you've got those signed off. These are very, very simple, basic things that you need to have if you're looking after the safety of your employees. The reason is, they're the first things that a health and safety executive would look at if they come and carry out an assessment at your premises. So, what other things do we need to think about? Well, obviously, you know, the government's talked about having people to stay at home and work from home as much as possible. That hasn't changed from day one. It's been lost in the media hype and all the rest of it. But fundamentally, if you've got work that can be done at home, then try to get your staff to work from home. And I'll talk a little bit later on about some of the things you might need to think about. But fundamentally, if they can work from home, get them to. If they can't, then what sort of steps are you taking to make sure that you're minimizing any further transmission risks? And I know we've got a 2 meter apart social distancing process at the moment, which most people are abiding to. That's quite likely to be dropping sometime in the near future, but whether it does or it doesn't stop the fact that people need to be careful. They need to think about themselves, their own health. They need to think about the health of each other. Basic things. But simple things like washing your hands regularly, every 20 minutes for 2 minutes, you know, with soap and water is a great way to minimize this transmission of the virus, because good old-fashioned soap and hot water actually destroys the virus itself, and it means that it's no longer there. Minimizing your contact with other people. So what have you got in place? Have you put physical barriers in place? So even in an office, you can put up clear perspex screens that people can communicate through, but it stops the likely transmission of the virus through your breath, through the vapor of your breath. You can, if you can't do that, can they work back to back? So they're actually facing away from each other. Can you minimize the amount of time they're spent in each other's company? So only one person going into the canteen at a time, if that's what you have. Staggering your lunch breaks, staggering the times that people arrive at work. That can itself, if you can fit it into the workplace, minimizing the number of people you've got in the office. So thinking about your flexible working and how that was going to work, especially as we still have some furlough opportunities where we can still pay people to be working part-time and flexible working part-time. So there are some things that you can do to try and do that. If you can't stop, so for example, maybe you have some drivers and you have to have 2 people in a vehicle or 2 people working as a team together, then try to keep them together as the same team all the time. It means that if one person presents with the virus, then you can self-isolate those 2 people, and it just means you've got some idea and control of where that team is and do the necessary steps to protect everybody. In the workplace, simple things like one-way systems. If you're in an office block, do they have you going up one stairwell and down the other? Little things like that, so you're minimizing the amount of contact with each other at all times. So one of the things you might need to consider, if depending on your environment and whether you think you want to take this forward, and this is something you can absolutely place right smack bang in the middle of your risk assessment as a step that will protect your business, and that's something called fogging. So fogging is an aerosol delivered disinfectant, antibacterial spray that actually kills 99% of the virus. And if done properly, it will kill the virus for up to 20 days and make sure your workplace is protected for that period of time. That's a pretty effective way to reassure your staff that you've taken every reasonable step. Recommended you clear all your paperwork off desks and things like that, because they might get a little bit damp. But the problem is that if it's done incorrectly, what happens is the whole place is swimming. There's too much vapor, and it's got to be done in a way that's just misting it in, and then it gets into every crook and cranny, and it gets into the ceilings and under the desks and behind the computer space and all the stuff that's absolutely necessary for these things to take place. So it needs to be done by qualified and trained personnel. And there are some not so reputable companies out there who are doing this and jumping on the bandwagon. So it's worth doing your research to make sure it's there. And as I said, and this is the important thing, if you fog the workplace, then you can turn around and place that within your risk assessment and have the protection of that reputable company guaranteeing that they have killed the virus for 20 days. So I mentioned before there about people working from home. So what sort of things do you need to think about there? Well, when this all happened on the 23rd of March 2020, we had this chaos and loads of people started working from home. And they sat at the dining room table on a normal dining room chair. And the problem with that is that it's not appropriate for your back. And we've lost 7 million hours due to musculoskeletal disorders over the last 10 years. That's a huge amount of loss of productivity in the workplace. Never mind the people who are tired, stressed, their eyesight's are sore, all these other things that are impacting for people to be working at home. The kids are getting under their feet. They're not productive. They're sitting like that picture there with the girl sitting with it on her lap. These are not good positions for us to be sitting in. And we need to be thinking about whether we do that. So there are risk assessments that you can carry out. There are risk assessments the employees can carry out for themselves, but you might need to consider, if you have people who are going to be working at home for any considerable length of time, that you actually put up an appropriate workstation in place. Do they have appropriate IT equipment, keyboard, mouse, screens that are working? Do they have an ergonomic chair they can sit in, even just so they're sitting with the correct posture rather than slouching on the sofa trying to do work, which isn't very effective. So you need to consider all of these things, and that would be worth those considerations to make sure that you have covered that off, and they're not going to come to you and say that their injury, the thing that's stopping them from coming to work, is that they didn't have appropriate stuff and they were made to work from home. And the other thing, just in finally closing, that you need to consider is the mental health and well-being of your people. If they're working at home, the risk is they become socially isolated, and social distancing is not about social isolation. So you need to keep in touch and communicate with your teams as much as you possibly can. Make sure they're okay. It's not necessarily just communicate about work. Sometimes just give them a call, touch base with them, see how they are, how they're coping. And this is one of the things, we're a social creatures, so we actually need social interaction. And in some cases, we need to get those people back into the office, making sure we've got appropriate social distancing measures and everything else in place to look after them. So in finishing, that's just a little brief update of the key things we need to think about. I'm Alistair Ross. I'm the Chief Executive of Wedo Health and Safety Limited. If you have any questions, then feel free to give us a call and we'll see if we can help you out as best as we possibly can. Thank you very much indeed for your attention, and I'll hopefully speak to you again.